Welcome to the Point. This past week here in Michigan, we saw another round of restrictions put in place to try to help slow the spread of COVID-19. Now, these restrictions, while they are not as strict as those back in the spring, will still have an impact. For example, it means once again, many of us are working from home, but others aren't working at all, laid off. Businesses that will be greatly impacted, and that means a loss of revenue for local governments and the state government too. The question is, will the federal government come up with another round of stimulus? I talked with Congressman Fred Upton this week. He's a member of a group called the Problem Solvers, 50 members, evenly divided between Republicans and Democrats who try to work together to get things done. And he was somewhat optimistic they could have an impact. It's an interesting time to be in Washington, trying to govern in a pandemic and trying to somehow legislate something that could help people out during that pandemic. Talk to me a little bit about what you anticipate after the Thanksgiving break when you and your colleagues come back. Is there another stimulus to be had in Washington?
Well, I sure hope so. This week, of course, we had our leadership elections, at least in the House, so Republican and Democrats. Kevin McCarthy, Nancy Pelosi were both elected as our leaders. That formal vote then will be in January when we get sworn in on January 5th. But we've laid some groundwork. The Problem Solvers Caucus had a couple of meetings this week. We're hoping that we can come up with a package that can pass the muster, that'll be obviously bipartisan, the president can support. But we really just can't wait till next year. I mean, we know what's going on, not only here in Michigan, but around the country too, with restrictions on, particularly on small businesses, the loss of revenue, sales tax revenue, other things to our local units of government. Our healthcare providers, our hospitals, I mean, they're stretched to the max. And particularly now as we have a vaccine that's on the threshold of getting that FDA approval, we got to make sure that we have the funds in the pipeline to actually get it distributed across the country. All these are new costs. They all have to be included in a package. And I'm hopeful that we can get it done in those 2 weeks of December when Congress comes back, rather than, in essence, wait until, let's face it, the end of January or even February, the new president, the new administration, to try and get things done. And meanwhile, not only those small businesses, but the workers that are there lose everything. We can't let that happen.
How well do you know Mark Meadows over at the White House? Because it seems that he's a key player in this as the chief of staff and the go-between between Congress. Have you had any conversations with him?
You know, I've not. I know him pretty well. I have his private cell. He kept it from when he was a House member. I've communicated with him a number of times in the last number of weeks. I've not communicated with him since the election. So, but his name came up in a discussion that I had just 2 minutes before we started this taping, in terms of, you know, how can we get some action out of the administration on these different issues. Our group, the Problem Solvers Caucus, has been in communication with him. And I'm just hoping that when we do come back, remember, we're going to be out of session. I'm going to be home the week of Thanksgiving. But a lot has happened this week to hopefully get some legislative tractions when we come back. He'll be part of that. He has to be.
The gap, and I should say this is just from a long distance away watching this process. It looks like there's still a really big gap between what Democrats would like to have in another stimulus and what Republicans in the Senate, pardon me, might be willing to do. How do you bridge that gap if you can?
Well, we recognize that. That's number one. But number two, you know, they've been really since spring, since May. That was when Pelosi passed her first package. It was over $3 trillion, and it didn't go anywhere. And to continue to insist that that's going to be it, it's not going to go anywhere. The president's not going to sign it. McConnell's not going to move it out. And we will be trapped in this never land until the next administration. And frankly, even then, I expect the Senate to stay in Republican hands. Even then, with a President Biden, that package is not ever going to get to his desk. So let's figure out what we can do now. So it would include unemployment. It would include aid particularly for our hospitals, our healthcare workers. They've gotten a lot, billions of dollars in advance payments for Medicare. They have to be forgiven. This has been a universal thing. Republicans and Democrats have supported that. We got to help our schools. Here in Michigan, whether it be a university or a high school, you're out of business right now. You need more resources, particularly as you come back. Broadband, all these students and families, they need that. Unemployment claims, of course, they expire as well. It's good news that our unemployment numbers have come down, but we're not out of the woods yet. And of course, now that we're on the verge of having this vaccine, we know that we have to have more testing. I got tested today. That's becoming more prevalent now in terms of across the country, but it takes resources to get it done. So there is a pathway here that we can get done and get it, at least this next step, behind us. But it really has to happen in December because we can't wait until February or March.
And that's not the only thing that can't wait. The government needs to be funded, and in the absence of creating new budgets every year, we have become used to something called a continuing resolution. That's up in December too, right?
Well, yeah, right. That's right. The fiscal year ends September 30th. So back in September, we passed a bipartisan bill that extended things until December 11th. Level funding, didn't increase any spending or, sort of autopilot. That comes to a conclusion. So we've got to deal with that. The appropriations committees in both the House and the Senate have been working on this. And I hope that we have something done to obviously avoid then a shutdown. But we haven't seen any meat or potatoes in terms of that legislation yet. Probably won't see it until the first week of December when we actually are getting close to voting on that.
When you come back, you've got a busy 2 weeks. I mean, if it was just those two items, that would be a pretty heavy lift. What is the attitude post-election in Washington now? Is there some sense that this is a settled issue and we move forward, or are there still people that are questioning the election?
Well, it's a couple things. It's different. Every lame duck is different. This one is different because Republicans, frankly, in the House weren't expected to pick up any seats. We're supposed to lose 15 or 20. We're going to pick up about 10 or 12. We've got a couple of elections that are still, being counted. Absentee ballots are not going to be done for still a number of days. But we're picking up seats. You have this real issue with Speaker Pelosi in that this is a little bit of an inside baseball game, but even though she has certainly the support within her caucus, a strong majority, she still has to get 218 votes on January 5th. And a number of Democrats, like when John Boehner was Speaker and Paul Ryan was Speaker, didn't get 100% of your side. And when that happens, you still have to get 218 votes. So if literally 5 or 6 Democrats say no, and last time there were, I think, 10 or 12 that said no to her, she doesn't become Speaker. So that will be an overriding thing. And of course, in the Senate, these 2 special elections that are happening in Georgia, they will determine who's in charge of the Senate. So there's a lot of uncertainties that are out there. And so the focus on December isn't so much yet, just because the election hasn't been really settled from November 3rd.
From the U.S. House to the State House and the Speaker of the House, outgoing Lee Chatfield. That's next. To the Point. Welcome back to the Point. 2020 has been an interesting year, no doubt, to be an elected official, no matter at what level, federal or state, and perhaps more challenging if you're part of leadership. That's the case of Speaker of the House Lee Chatfield. He's got about 6 weeks left in office. He's term limited and won't be back in the legislature next year, but he is still optimistic in the time he has left that he can do something to combat COVID-19 and perhaps more, something to create a dialogue with the Whitmer administration. Mr. Speaker, as you know, the governor, through the Department of Health and Human Services, issued new restrictions aimed at battling COVID. They are now in place. And she, again, when asked about it, said that the legislature wasn't participating. You and I have talked during the course of this pandemic, and you have said you do want to participate. So it feels like there's a disconnect. Is there a chance in what will be the final days of your time as speaker that you'll be able to get with this governor and be a partner at the table?
Well, I would hope so, Rick. I mean, when you look at the very beginning of COVID, the Republicans have been at the table. The question is whether or not the governor wants to sit at that same table and help us make these decisions together as a legislature and executive branch, which is what the judicial branch required. But when you go all the way back to the beginning of COVID, Rick, we led the nation in providing funding early on for COVID in our state. When you look at that, we were working with the governor on executive orders, and because of that, even extended the first state of emergency because we were working with this administration. After that, the governor went alone, and then we introduced our own plan that wasn't a one-size-fits-all, but it was regional and it was risk-based. After that, we spent billions of dollars together collectively to deal with COVID in our state. After that, we dealt with COVID liability protections for our small businesses and universities and schools. We dealt with healthcare liability protections. We dealt with our nursing home issue and provided funding and testing for them. Since then, we introduced a new plan, Rick, that dealt with COVID in our state, but also provided a metric so people had something to shoot for, because people need to know not only what the data is saying, but they need to know if X is reached, then Y policy is enacted. We need a forward-thinking plan. The governor has not yet provided a forward-thinking plan. It's simply been a reactionary plan that deals only with shutdowns. So any accusation that we haven't been at the table and ready to work with this administration is simply, Rick, not true. And I will go a step further. When you look at everything that the governor just initiated through the health director, not one of those things, not one, did she ask the legislature to enact in any conversation that we have had in the past several months. And since the Supreme Court hearing, the governor, the majority leader, and myself have not been on a phone one time, just the three of us talking about this, though there's been repeated attempts to get the governor on the phone or on a Zoom or in person. We're ready to work. We've got our sleeves rolled up. We're here at the Capitol, but the governor needs to decide whether or not she wants to work with us.
My recollection is the governor said that there had been a quadrant phone call, but that would have included the Democratic leaders as well. You were on that, right?
Yeah, there's been one quadrant call in the past several months, Rick, and that was with multiple representatives. That was with a bunch of staff, and those are good. Those are productive. It was simply an update to give to us about what Dr. Khaldun was seeing across the state. But when there was a request for a follow-up call for just the three of us to meet and begin negotiating, it went unanswered. And Rick, that's what we need to do. We just need to be at the table. We can't anymore be looking at this through a Republican or a Democrat lens. COVID's not discriminating right now across the country on whether a Republican or Democrat is in charge. COVID right now is not discriminating in the state of Michigan on who gets it based on who's Republican or Democrat. So why are we bickering as Republicans and Democrats here in our state? Let's just sit at the table. Let's make these decisions together, because when they're made in a vacuum, like the recent decision regarding restaurants, thousands of people's livelihoods are being hurt unnecessarily, with really, Rick, no data being given to these restaurant owners that the spread is actually occurring in restaurants. So we have to make these decisions together, because the people of the state of Michigan deserve to have their voices heard, and they deserve to have a seat at the table when these decisions are being made. And right now they're not.
In a week and a half or so, you will come back into session in what is traditionally looked at as lame duck. Is there any opportunity in those final days? And first of all, do you know how many days you may be in session in December? And in those days, is there any feeling on your part that you can get a chance to sit down with the governor and work on some of this COVID response, or is that something that's going to have to wait until next session?
You know, there's several weeks right now planned, Rick, of lame duck session where we need to continue being at the table dealing with COVID and any other important policy issue that's before our state. I always have a positive outlook, Rick, that I'm willing to sit down with someone and talk with someone. I'll never let past disagreement stop me from sitting down with someone and working with them in a bipartisan way to figure things out for our state. And I'll never let past quarrels get in the way of just ensuring that we can meet face to face or over Zoom like we are, or on the phone, right? As leaders, we can't let our differences stop us from having dialogue. And I'm committed to that. And I'm ready to work with the governor. I'm ready to work with the majority leader on whatever policies we can agree on to move our state forward, because that's what you need in divided government, Rick. You need to reach a consensus, and that's what I'm committed to doing.
Is there something in your mind that you think you guys could agree on? I mean, the governor wants a mask mandate. That seems to be a non-starter with the legislature. Is there? And I'm not asking you to negotiate with me through the governor. That's not the point. The point is, I'm just trying to, in my mind, visualize what you guys might agree on.
Well, negotiating with you right now to the governor may be better than what we have going on right now, Rick. So what I would tell you is the governor would already tell you right now that there's a mask mandate in place from the health director, but at the same time asks us to initiate one through law. So it's more of a political talking point. Let's be honest, it is what it is. And Rick, when you go into your local gas station or your local supermarket or your local restaurant, you know what you see? By and large, you see people complying with wearing masks. And I think wearing a mask helps. It's just not the end all solution. So we have to do more, right? The biggest thing that the governor and majority leader and I could get together and agree on is what metric is being used to initiate closures or shutdowns. Meaning if Y standard is met on whether it's people who have gotten the virus or whether it's bed capacity in a region, then X policy is put in place. That's a metric people can depend on. We need a forward-thinking plan, Rick, not just a reactionary plan every month that deals with closures and shutdowns and tells the people of the state of Michigan, we'll reevaluate this in 3 weeks and see where we're at. No, let's actually use a scientific model with data to provide certainty. We've introduced plans that have done that, and I'm hopeful the governor will come to the table and agree to do the same thing.
I want to move past the COVID response right now, even maybe past the economy. In December, are there particular things that you want to see done before you leave office?
Yeah, a lot of that, Rick, will depend on conversations I have with the majority leader, my caucus, the Democrat caucus, and with this administration, right? There's many things I think that are still important to the state outside of COVID, and we have to sit at a table and determine what those ideas are, what those policies are, and move forward together. So I'm gonna go ahead and say I'm gonna have those conversations with the other partners before I get ahead and begin negotiating what those are.
When we come back, we'll hear from a Democratic member of the State House and his take on where things are and where they should be. Next, To the Point. Welcome back to the Point. 2020, it's been an interesting year, as I pointed out in the last segment, particularly for elected officials. There's been all kinds of disagreement in Lansing, including some calls for the impeachment of Governor Gretchen Whitmer. Speaker of the House, Lee Chatfield, that we talked to just a few moments ago, told me in that same conversation that will not come up for a vote in the House. Still, there are things that need to get done in the lower chamber, and we talked with Democratic Representative David LaGrand from Grand Rapids about what some of those things could be. Representative, here we are. We've been at this battle with COVID-19 for going on 9 months. The governor, through the Department of Health and Human Services, has tried to come up with more ways to combat this. And for the next 3 weeks, we're being asked to do some things, but mostly reiterating things that we've been doing. Where are we in this battle as a state, from your perspective, not just as a state legislator, but somebody who lives in your community and knows the plight of the people around you?
Sure. So, my perspective, obviously, I'm spending a lot of time on this because I am a state rep. And so I'm playing on 3 different levels at least, right? One is I'm a state rep. And so we've got to think about policy here. And I spent a lot of time about a month ago working on COVID protections for employers and employees, which we passed through the House. The other part of it is on a very personal note. My mother lives with us, and she is 78 years old and immunocompromised. And so I cannot afford to take this lightly. I'm not that concerned about myself. I don't have pre-existing conditions. I'm 54, which means I'm not exactly a spring chicken. I'm not over the magic number of 60, but there's nothing magic about that. It's a sliding scale, right? We know 20-year-olds are in a lot better shape than 54-year-olds. But I'm not really worried about my kids. I really just don't want to be the thing that kills my mother. And so that's really concerning for me. And then also I am, 50% owner in a distillery, which has essentially 2 big restaurant operations, one in Grand Rapids and one in Grand Haven. And we just closed down in-person dining. And that's something that's going to be really hard to navigate around. So people in the service sector it's tough, and as a business owner and a legislator, I'm really worried that sometimes we forget the middle. And so, we discuss things I think are silly, like bailing out cruise ships. And then at the bottom end, we talk about unemployment help, which is good. But if people don't pay their rent, there's another group that are going to get affected, and that's the landlords who are going to go bankrupt on their mortgages to the banks. So it's really important that we have supports for those middle sector businesses, and I guess I own one of them, as well as the workers. And we at Longroad feel terrible about having to lay people off, and they're really a lot more vulnerable than they were last time around when we had substantial federal assistance. So all of those things are at play. Now, what I've been saying to people in the last day or two is, the bad news is I am sick of this. And I find myself having COVID fatigue and having these impulses to go do things that I know are a bad idea. Things that I could work around. Fortunately, I don't have to go to the grocery store. I can afford to have somebody deliver my groceries. That's just safer. But I had the impulse to go to the grocery store. I almost went in and bought some donuts a couple days ago, and I resisted the urge. But we have the urge because, it's been a long time. Enough of this, right? I feel like I want my money back. I feel like I really paid attention. I was good. I should be able to be. Can I be done with this now? Unfortunately, we don't have a vaccine, and our numbers are more than 10 times what they were during the first surge. I mean, the first surge was got bad around 750 to 1,000 cases per day. Now we're playing footsie with 10,000. I mean, this is beyond a problem. And so I think we just have to use our rational brains and acknowledge the emotion and the frustration, which I certainly have, and acknowledge that we're scared, and I hope my businesses survive. But there's light at the end of the tunnel. We know there's light at the end of the tunnel. I mean, we've had amazing news about that light just this week. I mean, all of a sudden, we don't just have one vaccine with 90% efficacy. We get another one that beat it. And I will say, as far as I'm concerned, the Trump administration gets huge credit for Operation Warp Speed. Whether or not I would hope that a Democratic administration would have done it too, but they did it. And getting every single possible vaccine maker racing for a vaccine has resulted in exactly what we all hoped it would, which is we're choosing between a series of good options for vaccines, amazing options. I mean, they were talking about maybe 70% efficacy, and if we're at 95%, I mean, that is some pretty strong light at the end of the tunnel. The problem is waiting for it, right? Now, again, in my personal life, if I can get healthcare providers vaccinated, if I can get people with pre-existing conditions and the elderly, like my mother, if I can get my mother a vaccine, my life gets a lot better the day that happens. So I don't need vaccines right away for my children. I don't even need them for me and my wife, but boy, do I want one for my mom. And then I don't have to be quite as vigilant as I am right now. So I think that, we don't want to get too discouraged by it'll be spring before we all get it. Not all of us are equally vulnerable, and we know that. And so we can, this is a public health crisis, and we've got to keep using the data. And this stinks. It is not fun. I really wish this didn't happen. I wish COVID didn't exist, but denying it isn't going to do us any good, right? I think we just got to keep working on the frustration.
As we come to a new week, it's the week of Thanksgiving, and it will no doubt be different than most Thanksgivings. Still, we hope you and your family can celebrate safely, even if it's remotely. And next week, we will continue to talk about what's going on in our state and what's going on in state government when we introduce you to the new Speaker of the House and Democratic leader in the House. We'll see you next week. To the point.